In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. From breakthroughs in medical research to the latest in life-saving procedures, medical advancements are emerging all the time. Let's take a closer look. Healthcare workers face the challenge of handling patients every day, and many of them are getting injured, some seriously. Data available for registered nurses shows that over 13,000 of them are injured on the job annually. Research reveals that in a typical 8-hour shift, a nurse is called upon to lift about 1.8 tons, almost the equivalent of 2 cars. 38% of nurses suffer injuries severe enough to cause them to leave work. Add to this the experience of other healthcare workers like nursing assistants, home healthcare workers, and emergency responders, and it impacts the industry by up to $20 million a year in lost time alone. There is a solution, and in many cases, it's already available. It just doesn't get used often enough.
Although medical centers have heavily invested in safe patient handling equipment, the real trick is to find quick, simple solutions to drive high user compliance.
Caregivers will usually use mechanical aids in working with obese patients. Ironically, it's the average-sized patients that can do the most harm because workers are often too rushed to use the appropriate tools for a quick lift. In the past, patient lifting systems have been bulky, inefficient, and difficult to use, resulting in only about a third of healthcare workers using them. WyEast Medical provides simple, effective, and cost-efficient patient transport devices that protect both healthcare workers and patients from unnecessary injury.
In general, the response has been mixed. It seems that the tools are accessible and are easy to use, in fact, are the ones that get used. For example, the pink slip. That's a perfect example. Often there's just this perception that it takes way too much time to go get a transfer device, prepare it for the transfer. Therefore, the caregiver does a manual lift and puts themselves at risk of injury.
Most of the over 6,000 hospitals in the U.S. use some type of safe patient handling equipment. WyEast products are simple to use, adaptable to a wide range of patients, and require no power supply. There's no reason why healthcare staff shouldn't use them every time.
In today's healthcare environment, time is at a premium. The nurses and caregivers have more to do and less time to do it in. So the mindset is to get the lift done as quickly as possible. If the lift and transfer equipment were readily available and easy to use, they would be more inclined to use it.
The company's flagship product, the Total Lift Transfer Chair, has an integrated lateral transfer system and is able to transform from chair to stretcher. Patient transfer slings come in a disposable model to limit the spread of infection, or a reusable model. Slings are clearly labeled to ensure correct positioning and color-coded for unmistakable identification. Both disposable and recyclable, WyEast Medical's pink slip slide sheet allows friction-free gliding of patients from one surface to another with ease.
Patients are not like boxes. They don't have handles that come in all shapes and sizes. And maintaining good body mechanics can't always be done during a lift. Patient weight is not always the issue.
Hospital budgets are shrinking. Both patients and staff are aging. Caregivers are being assigned more patients, and they are being presented with more complex illnesses. Effective, safe patient handling equipment should require fewer workers for a transfer, and when used correctly, ensure a reduction in sick days because of staff injuries and liability from patient injuries.
It's apparent that these injuries are happening in what we call the critical lift zone, which is 130 to 250 pounds. And the solution is to get lift and transfer aids that these caregivers will use in this critical lift zone, and then we can really start reducing the injuries to these caregivers.
Our healthcare workers provide excellent care and compassion to their patients. They deserve to be protected too.